Several school systems in Massachusetts and other states are bringing back mask mandates as COVID-19 cases continue to rise. Here to answer questions is Dr. Shira Doron, the new Chief Infection Control Officer for Tufts Medicine Health System. Congratulations on that.
Thank you.
Good to see you.
All right, Dr. Doron, the U.S. now sees more than 470,000 infections every week. We think that's likely an undercount, of course, because so many people now just test at home and no one is reporting those numbers. So what do you take? What's your take on these mask mandates in schools? I can imagine there's probably a lot of parents who say kids have been through enough, but what's your opinion?
Well, it's definitely a huge undercount of cases, but the question is, what's our goal here? And I would argue it's neither necessary nor reasonable to attempt to prevent every positive COVID test. Our goal should always be prevention of disease and death. And today we have widespread immunity that protects many, if not most of us, against the worst complications of COVID. We have many tools in the tool shed. Those at highest risk, though, those who are older or have significant medical problems, may choose to wear masks indoors now since cases are up a bit, but know that these ups and downs are what we can expect forever.
Okay, so the CDC says community levels of COVID-19, they are high in most Massachusetts counties, including Middlesex, Worcester, Suffolk. So what is your advice to residents? You mentioned those at risk, should potentially be cautious.
Yeah, but these days it is actually hard to know whether a county with a high designation is actually different from one with a medium or low designation. The risk level is largely determined by COVID hospitalizations. But in Massachusetts, we know that over 70% of patients in the hospital with a diagnosis of COVID aren't being treated for COVID. Most are there for other reasons. And we test everyone in the hospital, whether they have symptoms or not. And in other states, they don't do that. So their numbers and their risk category will automatically be lower. That being said, we know from wastewater and other things that there's a lot of COVID out there. So high-risk people may want to take extra precautions.
Well, speaking of the COVID that's out there right now, let's talk about the new subvariant XBB 1.5. It now accounts for the vast majority of cases here in New England, about 70% of COVID infections. It's obviously more contagious than the other subvariants out there, but any evidence yet that it's more dangerous or is kind of markedly different than all these other, would feel like countless Omicron subvariants that we've seen over the last year?
Yeah, XBB, like the other variants that we've seen, it's evading the immunity that our population has right now from vaccination and infection. That gives it a growth advantage. Whether it's inherently more contagious isn't totally clear, although it does seem to bind to cells really well. And no, it's not causing more severe disease. We're seeing very few patients in the hospital with really severe COVID. Prior infection and vaccination are still protective against complications of COVID, even XBB.
Okay, Dr. Shira Doron, thanks as always for joining us.
Yeah.